this lesson, I'm going to be explaining preeclampsia and your role in providing safe and effective care to this patient. So with preeclampsia, this is a hypertensive disorder in pregnancy. So it occurs in pregnancy. We have hypertension. This patient has to be over 20 weeks gestation. And she has to have proteinuria. So this is a must-have. She has to have protein in her urine. And I remember this as the P and the P. So preeclampsia and the proteinuria. It's always present with preeclampsia or they're not preeclamptic. And delivery. This is the only cure, is to deliver the baby. So for preeclampsia, we say the patient must be hypertensive, but what does that mean? So let's look at what numbers are going to classify us for preeclampsia. So blood pressures have to be 140 over 90. And it's not just a one check, 140 over 90, we're going to check them for preeclampsia. No, we're going to let them take a little rest and check again. So 140 over 90 times 2. So they have to have this 2 times, and it has to be 4 hours apart. So it's not going to be back-to-back blood pressures. We want to give them a little rest time in between. Our other option is that they could have a systolic blood pressure of 160 or greater, or a diastolic blood pressure of 90 or more. So I remember this 140 over 90 or 160 over 90. Now, I just want to make sure you have an understanding of this. So it doesn't have to be 160 and 90. It could be a patient that has a blood pressure of 160 over 70, and that's going to classify her. Or it could be a patient that has a blood pressure of 110 over 90, and that will classify the patient. So what does this patient look like on assessment? A woman will usually present with sudden increase in edema, and usually in the hands and the face is especially where it's found. Why does this happen? So fluid is being retained. So when the fluid is retained, that's because the body is not filtering or pumping correctly. So for this reason, we're also going to have sudden weight gain. So again, because of the fluid. The heart is not pumping as effectively, so it all backs up. Headache. So this is because we have high blood pressure. So you have a patient that went from normotensive and then became hypertensive. So that patient's going to have a headache. Another assessment finding is going to be complaints of epigastric or right upper quadrant pain. In preeclampsia, there is inflammation happening all through the body. So the liver is inflamed and causes elevated liver enzymes, and it's also going to cause abdominal pain. So that's why we get that right upper quadrant pain, is the inflammation that's happening throughout the body. And so that liver gets inflamed. Vision changes can also occur. So this is a huge, not so good symptom. This means that we have that inflammation occurring now in the central nervous system. So we have swelling. So because of this, we get irritation of the brain and we get vision changes. So not good. All right, proteinuria, our last little assessment piece. And remember, this is a must-have. That P and P, preeclampsia and proteinuria. So why do we have proteinuria? So that is because the body's sick and inflamed, right? So our kidney that usually filters everything back out into the bloodstream is inflamed and not working correctly. So that filter is damaged. So since the filter is damaged, it is not going to be able to keep the protein in the blood where it should, and instead it's going to spill it out into the urine. And so we're going to have proteinuria. Our management of this patient. So that is going to really revolve around safety. What is the safest thing for this patient? So remember, delivery is the only cure for preeclampsia. If it is safe to keep the patient pregnant longer and safe for the baby as well, then we will keep her pregnant and she'll just be monitored. So in this case, the patient would be kept probably in the hospital and receive something called magnesium sulfate. This is given IV, so it's an IV medication. This is given prophylactically. and I will tell you what this great medicine does. So magnesium sulfate, it's given IV prophylactically. So when we have preeclampsia, we can progress. So we can get worse. So the next step after preeclampsia is called eclampsia. Eclampsia means the patient has had a seizure. So we've progressed. The patient is only eclamptic if she has a seizure. So magnesium sulfate is given as seizure prevention prophylactically. Now, a really terrific side effect of magnesium sulfate is it lowers the blood pressure, which is exactly what we need, right? So that's terrific. If that's not working for us, if the blood pressure still aren't low enough, or we're trying to manage without giving magnesium sulfate, then we can give antihypertensive. So like labetalol, our drug of choice here. So that will help also to manage the blood pressure. And then fetal assessment. So let's talk about the fetus here. We have two patients, not just the mom, but also the baby. So we need to be watching the fetus and doing assessment on it as well. So this would be looking at blood flow through the placenta to ensure the fetus is getting good blood flow. And fetal measurements are done. And that's going to help us to know that the baby's gotten good nutrients and is growing properly. So remember, with all hypertensive disorders, we worry about IUGR, that intrauterine growth restriction. So with preeclampsia, the fetus doesn't grow as well, hence the growth restriction. But why is that? That's because the blood flow into that placenta is not at its best. We need a good, healthy blood flow through the placenta in order to get nutrients to grow that fetus and not have IUGR. So the preeclamptic patient is going to need to receive some education on when to call the doctor. So if she's having any nausea, vision changes, headaches, epigastric pain, or increased swelling, she's going to need to let the doctor know. So all signs that we are progressing, especially that vision change thing. Daily kick count. So this is something the patient can do at home. So we want to tell her to take 2 hours and try to get 10 kicks within that 2-hour window. She might get 10 kicks in 5 minutes. That's perfect, but she has 2 hours to get 10 kicks. If she doesn't, then she needs to call the doctor. And then home blood pressure. So she can be checking her blood pressures at home. And our numbers here for her to notify are that 140/90 or the systolic of 160 or diastolic over 90. Our nursing concepts for our preeclamptic patient are going to be reproduction and perfusion. So we're worried about perfusion to all the organs and to, of course, through that placenta to the fetus. Okay, so our key points, let's pull this all together. So if you remember these, you will understand preeclampsia. The patient has hypertension. Blood pressures are 140/90 or more, or systolic over 160, diastolic over 90. And remember, this has to be ×2 and they have to be 4 hours apart. Proteinuria, an absolute must-have. The patient has to be pregnant 20 weeks or more, also a must-have. And then magnesium sulfate. So this is given IV and it's a seizure prevention and delivery. That is our only cure. Make sure you check out the resources that are attached to the lesson. Be sure to review the different hypertensive disorders so that you can differentiate between them. Now go out and be your best selves today, and as always, happy nursing.